Tolterodine Tartrate is a medication used to treat an overactive bladder. It works by relaxing the muscles in the bladder, which helps improve your ability to control urination. This medication can reduce leaking of urine, the feeling of needing to urinate right away, and the frequency of trips to the bathroom. Tolterodine Tartrate belongs to the class of drugs known as antispasmodics. The recommended daily dosage and the optimal timing for taking this medication should be determined by consulting with a healthcare professional. Before you start taking Tolterodine, make sure to read the patient information leaflet provided by your pharmacist. Take this medication by mouth, usually twice a day, with or without food as directed by your doctor. Use it at the same times each day to get the most benefit from it. The dosage is based on your medical condition and response to treatment, and it's important to inform your doctor about all the products you use. Do not increase your dose or take this medication more often than directed, as it will not improve your condition any faster and may increase your risk of serious side effects. If your condition persists or worsens, make sure to inform your doctor. If you experience dry mouth, dry eyes, headache, constipation, stomach upset/pain, dizziness, drowsiness, tiredness, or blurred vision, it's important to talk to your doctor or pharmacist. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. To prevent constipation, make sure to eat enough dietary fiber, drink plenty of water, and exercise. You may also need to take a laxative, so be sure to ask your pharmacist which type is right for you. Remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. It's important to tell your doctor if you experience any serious side effects, such as vision changes, severe stomach/abdominal pain, trouble urinating, or signs of a kidney infection. And be sure to seek medical help right away if you have very serious side effects, like fast/slow/irregular heartbeat, severe dizziness, or fainting. A serious allergic reaction to this drug is rare, but if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. And if you experience any other effects not listed, don't hesitate to contact your doctor or pharmacist. Before taking Tolterodine, it's important to let your doctor know if you have any allergies or if you are allergic to phytotaurodine. This medication may contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. Let your doctor or pharmacist know about your medical history, especially if you have had problems emptying your bladder, severe blockage of stomach or intestines, glaucoma, stomach or intestinal disease, severe constipation, kidney disease, liver disease, or a certain muscle disease called myasthenia gravis. Tolterodine may affect the rhythm of your heart, causing a condition called QT prolongation. This can sometimes lead to serious symptoms that need immediate medical attention. It's important to inform your doctor about any other medications you may be taking and any existing medical conditions, especially certain heart problems, family history of heart problems, or if you have low levels of potassium or magnesium in your blood. Be cautious when using Tolterodine, as it may cause dizziness, drowsiness, or blurred vision. It's advised to limit alcoholic beverages and avoid activities that may cause you to overheat. If you experience a fever that doesn't go away or any changes in mental/mood, headache, or dizziness, seek medical help immediately. Before undergoing surgery, inform your doctor about all the medications and products you use. If you are an older adult, be aware that you may be more sensitive to the side effects of this drug, and it may increase the risk of falling. If you are pregnant, use this medication only if clearly needed, and discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. When taking Tolterodine Tartrate, it's important to be aware of potential interactions with other drugs. This can affect how well your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Tolterodine Tartrate include mifepristone, potassium tablets/capsules, and pramlintide. It's also important to be aware that many other drugs, not just Tolterodine, may affect the heart rhythm, including certain antibiotics and medications for heart conditions. It's important to inform your doctor or pharmacist about any other products you are taking that cause drowsiness, such as alcohol, marijuana, antihistamines, and certain prescription medications for sleep or anxiety. Additionally, it's important to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Always consult your pharmacist about using these products safely. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact your local poison control center or provincial poison control center for guidance. Symptoms of an overdose may include fast, slow, or irregular heartbeat, fainting, unusual excitement, and changes in mental/mood. This medication should not be shared with others. It is intended for the individual it is prescribed to. If you forget to take a dose of Tolterodine Tartrate, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the usual time. Do not take a double dose to make up for the missed one. Make sure to store Tolterodine Tartrate at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.